I'm Dr. Abhilasha, consultant ENT at Belenus Champion Hospital.
Hi, I'm Dr. Meenukrishnan, ENT surgeon at Belenus Champion Hospital.
As 17th March is recognized as World Sleep Day, so we will be talking about sleep and its importance in ENT.
As ENT surgeons, patients come to us with complaints of snoring as well as disturbed sleep or are brought to us by their partners.
What is snoring?
So technically speaking, snoring is a harsh sound that is produced during your sleep due to a turbulent airflow leading to vibration of tissues in the back of your throat. This can happen if you have an anatomical or functional obstruction at any level along your entire upper respiratory pathway. So is all snoring bad for you?
Occasionally we all snore. Around 45% of Indian population snores occasionally, but there are some 25% people who snore every day. So chronic snoring is a problem. It can affect our cardiovascular health, our mental health and our mood. Whenever we don't get enough sleep, we are always in a bad mood the next day. But the most important relevant topic to us as an ENT surgeons is obstructive sleep apnea. Can you just guide us what does it mean?
So obstructive sleep apnea falls on one end of the spectrum of sleep-related disorders wherein there is momentary cessation of breathing during sleep that leads to episodic decrease in oxygen levels in your blood.
So does it affect the health of a patient?
Yes, it is extremely harmful for you because if you have multiple episodes of decreased oxygen levels in your blood during your sleep, this may lead to gasping, choking, arousal in the night, in the long run can also lead to pulmonary as well as cardiac issues. So does this only affect adults?
No, snoring can affect children also. As you know, children need a proper sleep for their better performance in school. And if they don't sleep well, they will always be in a bad mood in the school. So if parents see that the children are getting snoring each and every day, then they need to be evaluated by an ENT surgeon. The main causes can be adenoid or tonsil hypertrophy, which are easily corrected by surgery. And long-term snoring with adenoid tonsil can also cause impaired hearing, which need to be addressed so that they can perform very well at school. So how do we diagnose a patient with obstructive sleep apnea?
That's a very good question. So when a patient comes to us telling their complaints of disturbed sleep or snoring, first thing we ask them the history, entirely get to know what is their issue, since how long they have this issue.
But are there some specific symptoms we need to ask them?
Yes, there are very specific symptoms. So all snoring is not bad, as Dr. Abhilasha told you. When snoring is associated with certain symptoms like excessive daytime sleepiness, gasping or choking or pauses in breath during sleep, poor concentration, lethargy, irritability in the daytime, all these things are cause of concern to us. Also, if there is a family history of sleep apnea, you are at a higher risk of developing sleep apnea as well.
So overall, these are the symptoms which need to be asked from the patient. So are there any signs or are there any tests nowadays which we can do to evaluate such patients?
Yes. So once the patient comes to us and we are done through the history, we go for a general physical examination of the patient. Obesity has very well been established to be a very high risk factor for patients with sleep apnea. So we look at your general physical structure, your body mass index, we look at your craniofacial structure. If there is any abnormalities, that is probably causing your sleep disorders.
And as an ENT surgeon, we need to do a nasal endoscopy and check for the adenoids, tonsils, there is any physical roadblock in the airway, like the tongue is too big in size. So these are the things which are to be evaluated by an ENT surgeon. After that, we can do specialized tests because snoring is not a unidimensional thing. It is a multidisciplinary team effort. So we need to send the patients to pulmonologists, even cardiologists, and even a maxillofacial surgeon if there are any structural abnormalities. And the most important thing, which nowadays the test which is performed, which can evaluate sleep better, is known as a sleep study. So Dr. Meenu will be telling more to us about sleep endoscopy.
So sleep endoscopy or drug-induced sleep endoscopy, it is a procedure that we do in both adults as well as children in patients whom we are suspecting of sleep apnea. So how do we do this? It is basically an endoscopy done when patient is asleep. So we induce sleep.
Is it a OPT process or we need to book an OT for that?
So this is an OPD or a daycare procedure. We admit the patient for a few hours because we need monitoring post the procedure. So during the procedure, we induce sleep using various sedative agents, and then we pass a flexible scope through your nose, evaluate your entire upper respiratory tract, and it's a very important tool in assessing the dynamic functions of your respiratory tract. This is very important as most patients have obstructions which are both anatomical as well as physiological, and it can be at multiple levels in your upper airways.
So the next thing is like, how do we manage it now? So as an ENT specialist, first of all we have to evaluate whether it is a structural thing or a dynamic thing or a functional thing. Weight loss, then having a good scheduled sleep time, then eating well, then exercising, all these things will help. The next thing which is there is surgery. So as an ENT surgeon, there are various surgeries which can be done. Like for deviated septum, we do a septoplasty, we do a adenotonsillectomy, we do a very specialized surgery which is known as uveopalato-pharyngoplasty, which is for reduction of the size of the airway inlet so that the air can pass through easily, and the snoring, which is actually already told by Dr. Meenu that it is a turbulent airway, that will be reduced. So not only it will decrease the snoring in the sense the symptomatology of the snoring, but the side effects which can occur after if you don't undergo these surgeries will be reduced. So just let me know what are the side effects of snoring, because most of the people snore in India. So what are the other things, like what are the symptoms which we can get?
Yeah, so long term, as we mentioned before, long term snoring could be extremely detrimental for your health, because what happens in snoring or sleep apnea specifically is there is decrease in oxygen saturation levels in your blood, and when this occurs over a long period of time, this could lead to increase in blood pressure, specifically in your pulmonary arteries, called as pulmonary hypertension, and that again long term could lead to cardiac complications which would be lifetime and which are irreversible.
So not only hypertension, we can get diabetes, we can get irritability, we can get fatigue, insomnia. So the list is innumerable. So next time when we don't get a proper sleep, then we should always be aware of the fact that the snoring is not a simple term. There is a lot behind it. And the last thing which is not mentioned too much is the interpartner relationship, because it is very difficult to sleep the whole night with somebody who's like snoring bad. So that also it affects the relationship of a patient also. If you are experiencing any of these symptoms,
please visit your nearest ENT surgeon.
Thank you.
Thank you.